Last but not least, we have Dr. Ivan Vargas, Assistant Professor in the Department of Psychology at the University of Notre Dame. Dr. Vargas's talk is entitled Knowledge of Sleep Treatments and Healthcare Communication in the Perinatal Period. Thank you, Ivan.
Yeah, thank you for giving me the opportunity to present some of the data that we've been working on. Okay, can you see my slides okay? Okay, awesome. So thank you for the opportunity to share some of the data that we've been working on and collaborating with Nanit to better understand sleep treatments, especially in a healthcare context, and trying to better understand, in particular, perinatal insomnia. And so, as Natalie mentioned, I'm an assistant professor in psychology at Notre Dame. I wanted to first acknowledge the collaborators on this project. So really grateful for Maristela and Sham for all the work that they've done, and then Dr. Kaylin Hill, who's a colleague of mine here in the Department of Psychology. A lot of the work that the data that I'm going to be presenting today, this work is informed more generally by a lot of the efforts that I have been employing to better understand the risk and consequence of insomnia. We know, as many of you know, insomnia is incredibly prevalent in the general population. Up to 12% of the population experiences chronic or clinical insomnia, and these numbers are even higher when you look at acute or subclinical insomnia. When you look at the incidence rate of insomnia, it's also incredibly high, where we look at kind of new onset insomnia over the course of the year. Almost a third of individuals experience acute insomnia in a 12-hour or 12-month period. And not surprisingly, this has incredible economic burden and cost, in particular in the United States, but this is true all over the world, where you see both direct and indirect costs of having clinical or chronic insomnia. And maybe most importantly, there's a number of risk, or having chronic insomnia increases risk or vulnerability to developing a number of psychological and physical health disorders, kind of increasing the overall impact of living with insomnia. And as you would also expect, insomnia during the perinatal period is also highly prevalent. Some estimates suggest that nearly half of perinatal individuals report poor sleep quality across pregnancy and the postpartum period. Oftentimes, this is in the way of insomnia, or you see it via insomnia. And while a certain degree of acute sleep disturbance is expected during this period, excessive or prolonged sleep disruption can pose significant risk. And so, fortunately, in the case of insomnia, we have really good behavioral interventions to treat insomnia. So the primary one being cognitive behavioral therapy for insomnia, or CBTI, is a highly efficacious behavioral intervention that works really well for a lot of patients and a lot of different patient groups. The effects are durable over time, so there's evidence to suggest that that the clinical gains experienced from CBTI can last up to 24 months at least, or at least that's the longest we've tracked these therapeutic gains. It's gotten to the point where it's been acknowledged as a first-line treatment by a number of organizations, first-line treatment for insomnia. And also there's now sufficient or significant evidence to suggest that it also works in perinatal populations. Albeit most of this evidence has been in pregnant individuals, but it is showing to be a promising behavioral intervention for perinatal individuals. That said, CBTI also comes with a lot of its issues and barriers. Many of them that I'm going to highlight here, but mostly going to talk about this first one here, that despite being a highly efficacious and effective treatment for insomnia, for the most part, it's relatively unknown. It's also, even for those individuals that are aware of CBTI and can seek to get behavioral treatment for insomnia, in most places around the country, in most places around the United States, CBTI is mostly unavailable. Right now, it's still reserved mostly to kind of behavioral sleep medicine specialists or specialty clinics, and so it is not widely available. In a lot of situations, it's not a priority. We see this a lot in the perinatal population, where there are other things going on, but this is true across the board, where other psychological or physical ailments tend to take the priority over treating sleep. And then also it can be costly, both costly in terms of time, but also financially burdensome. And so I'm going to highlight a little bit more of kind of this, while these are a number of different barriers, and I just like to highlight it to give you a kind of high level view of kind of the state of the insomnia science. But really, I'm going to focus in on the unknown here, and I'm going to highlight two studies, one that we did a while back, and then the one that we did in collaboration with Nanit to better understand perinatal populations. But just to highlight kind of like where we're at on a broader scale with to what extent individuals are aware, have knowledge of their different treatment options for sleep, and particularly insomnia. What we did is a couple of years ago, we did a survey of nearly 3,000 people across the United States. This was a general population that was pretty well represented from different regions of the United States. These were adults and relatively well represented in terms of different demographic groups. But this was primarily a descriptive analysis to try to understand to what extent are people aware, primarily of CBTI, but of any form of treatment for insomnia. And so the data, not surprisingly, told me what I expected to find. So none of this is necessarily surprising, but these were efforts to try to quantify some of these issues, to try to quantify the barriers, because we often talk in kind of more of a clinical context. We often talk about this idea that people just aren't aware, don't know about CBTI, but this was an opportunity to try to descriptively quantify to what extent is this problem real. And so in this general population study, what we found was that these other treatment options were pretty widely recognized, and people were aware of them. But when you start to look at CBTI, the proportion or percentage of individuals that were even aware of what CBTI was really low. In this case, 15%. When you look at it across gender, women tend to be slightly more aware relative to men, but again, these proportions are really small, especially compared to the other treatment options that are not considered the first-line treatment for insomnia. And then when you look at when you ask individuals about the interventions that they're actually using, so when they have sleep disturbance, what are they actually doing to treat it? Again, you see a very similar story where CBTI is pretty seldomly used. So in this sample, it was when you look at kind of different groups of insomnia. Overall, it's we're talking about less than 10% of the sample. And so we wanted to try to, in collaboration with Maricela and Chan and Natalie, we wanted to try to replicate this, but in postpartum or perinatal individuals. And so we did a similar study and to try to replicate these results and do it more in a perinatal context. And so we surveyed 527 postpartum women from the Nanit registry. These were all individuals that had given birth in the past 12 months. Again, these were adults. The mean age of the infants was about 7.4 months. And for the most part, this is kind of the demographic makeup of the population. It wasn't the most demographically or from a socioeconomic status perspective, the most representative group, but I think it's still important to try to, again, quantify some of this, some of our assumptions about to what extent people are even aware of treatments for insomnia. And then in this case, to what extent they're being prescribed or referred for treatment for insomnia. And so the respondents answered questions about their insomnia symptom severity, but then also questions about their perceptions of sleep and insomnia and their interactions with perinatal healthcare providers, about the extent to which they were referred, like I said, referred for treatment for sleep or given any kind of information. And so in this sample, about 84% of the respondents to the survey reported new sleep problems during pregnancy or postpartum, which a lot of that is to be expected. But I think maybe interestingly, despite that the majority of women in the sample were reporting new onset sleep problems, only about 37% reported being asked about their sleep health. This was during the pregnancy visits. and then about 33.5% were asked about their sleep health during the 6-week postpartum visit. Of these, only 29% were referred or recommended to sleep treatment, and that was during the pregnancy visits, and then only about 10% were referred to any sleep treatment during the postpartum appointment. In this sample, about 50% of the women in our sample met criteria for at least subthreshold insomnia. So this is consistent with some of the literature that I was suggesting earlier that suggests that it indicates insomnia during the perinatal period is common and prevalent. And, in fact, at least in this population, we saw 16.4% that had met criteria for clinical insomnia based on the insomnia severity index. And then consistent with prior work, only about 14.4% of the sample had ever even heard of CBTI. So consistent with the other study that was looking at the general population. And then when you look at the sleep treatments that were recommended during the perinatal phase, again, you see a very similar story where for the most part, it's over-the-counter medications. And in fact, in this sample, there was 0% of individuals that were recommended to any form of CBTI or even any of the components of CBTI. So again, it gives a very kind of discouraging story about, to what extent, at least me as a behavioral sleep medicine specialist, to what extent we're doing a sufficient job of communicating with patients and providers that these are real options that are available to them. And so just in terms of like a general takeaway point, I think what this data does, in addition to kind of quantifying some of those assumptions that we kind of hold about to what extent, people are aware that CBTI is a treatment that's available for insomnia. I think it further highlights this translation gap, particularly in this population that is experiencing sleep disturbance maybe at higher rates than the general population. And so while, I don't make any implications or assumptions here about what the causes of or solutions of this translation gap are, but I think it really suggests that, continued efforts to better understand this and understand the barriers and identify what those solutions might be, especially in perinatal populations, I think will be incredibly helpful. Thank you, and I'm happy to take questions if there's time.